renal transplant ultrasound that was performed in a patient who had recently had a kidney biopsy. And you can see within the echogenic hilum of the kidney, there is an area of increased Doppler signal. When we put calipers over it to see what's going on in the spectral waveform, we can see that there's very high velocity, low resistance waveform. There's a lot of diastolic flow there. And so this is really diagnostic of an arteriovenous fistula. Whenever one is performing a biopsy, there's always going to be the biopsy going through small arteries and small veins, and that's why you really want to keep them, the biopsies, as peripheral as possible, so that the arteries and veins that are being biopsied through are small, and therefore they're less likely to bleed and less likely to create an arteriovenous fistula. This one, the biopsy was done too deep, and so therefore larger arteries and veins were able to fistulize here. And that's shown again on the spectral Doppler waveform by a high velocity, low resistance waveform, and showing increased Doppler signal. The increased Doppler signal is sometimes from the vessel itself, but it's also the vibration that the vessel has with an arteriovenous fistula. There's a bruit that goes on, and so in the same way you can put a stethoscope over a kidney transplant to be able to listen for an arteriovenous fistula, you can also put Doppler ultrasound over it and see if there's this kind of profound area of vibration that's caused by the tissues vibrating rather from the arteriovenous fistula.